All right. Well, welcome all. My name is Vanessa McElrath, and I'm one of the wealth management advisors here at ML&R. And we're certainly thrilled that so many of you could join us today. We usually like to host these types of events in person and with our clients and friends of the firm. I don't think we're quite there yet, but fingers crossed for maybe later this year that'll be possible. Regardless, so I'm really glad we could have our speaker join us virtually today to talk to us about all of the ins and outs of Social Security. We certainly know as advisors that filing for benefits can be really complicated, and that's why we take a pretty active role in helping clients navigate, simplify the process, and determine the best strategies. But we also know that it can be helpful to hear the message more than once, and you really can't beat it when it's coming directly from the horse's mouth. So today we have Phyllis Dills with us, and she's actually a public affairs specialist with the Dallas region of the Social Security Administration. And really her primary role is to educate the public about Social Security programs and services. So what she's going to do today is run through her presentation, but we'll leave some time at the end, probably the last 10 minutes or so, for questions. So I'll encourage you to utilize the Q&A feature. So if you hover at the bottom of your Ring Central window, there should be a little icon that pops up that says Q&A. If you can submit questions through there, we'll be monitoring those. And again, we'll make sure that we have time left at the end. And also, we're recording this, and we'll have copies of the slides that we'll be able to disseminate as a follow-up as well. So without further ado, I am going to turn it over to Phyllis.
Thank you, Vanessa. Good afternoon, everyone. I'm excited to be here with you today to give you some information about Social Security benefits. If you can just bear with me just a moment, I'm going to go ahead and get the presentation here on the screen. So the meeting you've been invited to, I feel like, was properly titled "Everything You Need to Know About Social Security." So we won't touch on every single thing about Social Security, but if you're looking for retirement, then I'm going to be providing you with a lot of information, exactly the things you're going to need to know and think about as you look toward retiring. We have a lot of information to cover today, so just bear with me as we go through these slides. But what we're going to be looking at, we're going to talk about our retirement insurance program, of course. We're also going to talk about survivor's insurance. Oftentimes, unfortunately, as we look at retiring, there are some of us that qualify for survivor's benefits, and that can play a big role in how you choose to retire and when, and so we need to be aware of those benefits as well. We're also going to talk about working while receiving benefits, taxation of benefits. We're going to talk a little bit about Medicare, and finally, we're going to talk about our online My Social Security account. So the retirement insurance program with Social Security was first created back in 1935, and it was designed to be a foundation that you could build upon with other pensions, savings and investments, or other income you expect to have in your retirement years. It was never intended to be your sole form of income. So we always encourage people to be sure and supplement their Social Security with some other form of retirement so that you're not dependent fully on Social Security. Now, to qualify for a retirement benefit from us, you do have to be insured to be eligible. And you insure yourself by working and paying those Social Security taxes in over the years. Now, when you do that, you're earning credits toward being insured. In 2021, one credit is worth $1,470 in earnings, and you can earn up to 4 credits in 1 year. So for this year, once you earned $5,880, you had your 4 credits from Social Security. Now, over your lifetime, you would need 40 credits to be insured for a retirement benefit. So you can see in as little as 10 years of work, you can insure yourself for Social Security. Now, if you had only worked 10 years, though, and stopped, that would negatively impact your benefits, and we'll get more into that as we go along. So when you look to retire with Social Security, you're going to have 3 options. You can do an early retirement, That would be taking your Social Security anytime between 62 and your full retirement age. When you do that, you're going to receive a reduced benefit. And that reduction is based on the number of months you are away from your full retirement age. So the longer you wait past 62 to receive, the higher your benefit's going to be. Now, the reduction that they place on a benefit for early retirement is permanent. It's not going to go away once you get to full retirement age. So if you choose that early retirement, you're always going to have that reduction in play. Your second option would be a full benefit, and that would be waiting until your full retirement age to draw. And at that point, you get 100% of your Social Security benefit. And then your third option would be a delayed retirement, and that would be waiting beyond your full retirement age to draw your Social Security. When you do that, you earn delayed retirement credits. And those delayed retirement credits are going to increase your benefit at a fraction of a percent per month. But what it equates to is a full 8% per 12-month period that you delay that you'll see onto your 100% benefit at full retirement age. So for every 12 months, you're going to gain that 8% increase over your full retirement age benefit. You can do that up until age 70. Once you reach 70, though, your benefit's not going to accrue any more delayed retirement credits. So you're not going to have that increase waiting beyond age 70. So this slide shows you full retirement age, and you can see here, based on the year you were born, what your full retirement age is with Social Security. Now, some people often, they're confused about what their full retirement age is, and I think that has to do with the fact that the full retirement age has changed since Social Security was enacted. When it was first enacted, everyone had a full retirement age of 65, but they made some amendments to the Social Security Act in the early 80s that extended full retirement age to 67. But they wanted to do a gradual implementation. So what they did is they spread it out over years, and that's why you see some people have 66 or 66 and so many months. But anyone born 1960 or later, full retirement age is now age 67. So this chart shows you how your age affects your benefit. When you choose to retire, what that does to your benefit. So we have an example here for you of someone with a full retirement age of 66 being eligible at 66 for $1,000 a month. If that person chose to take their benefit at 62, they'd have a 25% reduction in what they can receive from age 66. And then you can see, as you go across the slide there to the right, how that increases from year to year. And then after 66, you can see that delayed retirement credit of 8% per year all the way up until age 70. So you have some choices and things to think about when it comes to when you want to start your retirement benefit. But this is just one piece. That dollar amount that you can receive is one piece of the things that you may want to consider. We are often asked at Social Security, when can I draw my Social Security to get the most out of Social Security possible? And unfortunately, it's not a question we can answer for you. In order to answer that question, we would need to know one thing, and of course, that's going to be when you're going to pass away. And unfortunately, we don't have that information. So what we can do, though, is recommend that you think about things in your personal life that might have an effect on when you'd want to start your Social Security benefit. Things like your health, your financial needs and obligations. Do you plan to work during retirement and how that would affect your Social Security? What are your cash needs that you're expecting? The amount of your future Social Security benefits. Looking at those sometimes sway an individual one way or the other as far as when they want to start those benefits. And then, of course, family longevity. Knowing how long you're going to live and need income in retirement years is really kind of key in figuring all of that out. As we discussed, we don't really have that answer and know how long you're going to live in retirement, but you can look at things such as your family history and kind of help you come up with a ballpark estimate of how long you're going to live and need that income in retirement. Now, I do have some statistics here for you today. In the United States, a man reaching age 65 today can expect to live on average until age 84, and a woman age 86.6 years old. So these are just good average statistics to look at, but if you look at your family history and you see that those in your family are living longer or less time than this would help you kind of maybe come up with a ballpark idea. For me, both of my grandmothers lived into their 90s, and so that's what I'm using as I'm looking forward and planning ahead. Now, we talked earlier about insuring yourself, but I want to talk to you now about how we determine your benefit. So the first thing we do is we take your wages over your lifetime and we adjust them for changes in wage levels. Well, what does that mean? That means the dollar you're making today has a different value than the dollar you made 20 and 30 years ago. So we're going to take all of your earnings over your lifetime and put them on a level playing field with today's dollar. So once we do that, we're going to pull out your highest 35 years of earnings. And from that, we're going to get a monthly average. And that's going to give us your average index monthly earnings amount. And we take that amount and we plug it into a formula. Now, I want to pause here. We talked about insuring yourself in as little as 10 years, but your benefit would be negatively impacted if you'd only worked 10 years. And this is why. When we go to determine your benefit amount, we're looking at the highest 35 years. If you only had 10 years of work, then you're going to have 25 years of zero earnings averaged in there, bringing down how much you can receive back from Social Security. Now, once we get your average index monthly earnings amount, we plug it into a formula, and I have an example here for you today just to make things easier to follow. So we're going to be going over the 2021 retirement benefit formula, and we have an example of average monthly earnings of $7,000. So what we do first is we take 90% of the first $996. We set that over to the side, and that's where you see the $896.40 there on the right. Then any earnings over $996 through $6,002, we're going to take 32% of those earnings, set that over to the side. That's where you see the $1,601.92. And then if there's any earnings over $6,002, we're going to take 15% of those earnings, and that's where you see the $149.70 there on the right. So those three amounts on the right are added together and rounded down to the whole dollar to determine your benefit amount. Now, you may be looking at this benefit formula and questioning things like the percentages, the 90%, the 32%, the 15%, or the $996 and the $6,002. Those are called bin points, and they do kind of seem that they're in there randomly. So I want to give you a little bit of history about Social Security and how the formula was designed. So the 90%, the 32%, and the 15%. Social Security was created to be a social safety net program in which lower earners got back more in pre-retirement earnings than average earners or higher earners, okay? So you can see these tiers of percentages. That's how that's worked into the benefit computation for Social Security. Now, the $996 and the $6,002, those are called bend points, and they can change from year to year. They're tied to the average wage indice. And Social Security did that because if we have a good average wage indice, that means we have a lot of people working and paying those Social Security taxes. So the outlook for Social Security is good. It's going to positively affect those bend points. And of course, the reverse of that is true as well. If we have a lot of unemployment, then those bend points are going to be negatively impacted. The bend points are set each year in January. On January 1, they're used for the entire year and recalculated for the next year. If you retire this year, these will be the bend points they'll apply when they're calculating your retirement benefit. If you retire this year and we have new bend points next year, it's not going to affect you at that point. It's only going to affect you once you retire in the year you retire. Now, when you file for your retirement benefits, you may have other members of your family that can qualify. A spouse is mainly what people ask us about. So spouses can qualify for a Social Security benefit at age 62 or older, or at any age if they're caring for a child that's under 16 or disabled. An ex-spouse can qualify as well. In order for an ex-spouse to receive, the marriage had to last at least 10 years, though. Also, the ex-spouse has to be 62 or older and unmarried, and you must be divorced at least 2 years, and you or your ex-spouse are at least age 62. He or she can also receive benefits if you're not retired yet. So, your current spouse, in order for them to qualify, you have to file for your Social Security benefits, be receiving those benefits in order for them to apply. Whereas a divorced spouse, that does not have to be the case. You just have to meet those other qualifications. As far as what a spouse is eligible to receive, they can receive up to half of the worker's unreduced benefit. But in order for them to receive the full half, they have to wait until their own full retirement age to draw that benefit. If they file before their full retirement age, claiming any Social Security before then there is a reduction that's placed on the spousal benefit as well. Now, if a spouse files for benefits from you, it's not going to affect your benefits. And if a current spouse and an ex-spouse applies, that's not going to reduce your current spouse's benefit either. Also, a spousal benefit, in order to receive it, it must be higher than your own benefit. So in order for your spouse to receive, their Social Security benefit must be lower than what they can receive as a spouse in order to draw that instead. Now, there is one exception to that. If you were born before January 2nd of 1954 and you reach full retirement age before drawing those Social Security benefits, then you do have the option to file a spouses only application, receiving just spousal benefits, leaving yours alone, letting them grow, and switching to it later. However, if you were not born before then you have to follow the new rules, and basically it means that you have to take the higher of the two benefits. Now we're going to move on to survivor's insurance. If something were to happen to you or anyone who's worked and paid into Social Security, there are certain members of your family that can qualify for a benefit. If you have a child that's unmarried and under 18 or under 19 and still in high school, or an unmarried child that's disabled before the age of 22, they can qualify as well. Also, a widow or widower or divorced widow or widower can receive benefits. They're eligible to get full benefits at their full retirement age or reduced benefits as early as age 60. They also can receive reduced benefits as early as age 50 if they're found disabled by Social Security. As far as what a survivor is eligible to receive, a survivor can get 100% of the deceased worker's benefit at their own full retirement age. They have the option of taking it early at 60, and at 60 they can receive 71.5%. They also have the ability to receive reduced benefits on one record and then later switch to reduced or unreduced benefits on another record at a later age. So let's say you qualify for a survivor's benefit. You take that at age 60, get the 71.5%. At age 62, you now qualify for your own reduced retirement. You could switch to your own reduced retirement at that point if you wanted to. However, you do have the option of waiting and allowing your own benefit to grow, switching to your benefit at any point after 62, full retirement age, or even all the way up until age 70, really maximizing your benefit. So those are some options and things to think about if you qualify for survivor's benefits and you're looking toward retirement. Now, to qualify for the benefit, you have to meet the age requirement. You have to meet the marriage requirement, and you have to be unmarried unless you remarried after the age of 60. If you remarry after 60 and you're currently married to that person, you still can qualify to continue the survivor eligibility. We also have parents' benefits under the Survivors Program. It's pretty rare that someone qualifies for those, but they are available and it's important to understand. So it's for a parent who is at least 62 and was receiving at least one half financial support from their child that passed away. In order for that parent to qualify, that survivor benefit also must be higher than their own Social Security benefit. If it is, then they can switch to the survivor's benefit. We do also still pay a lump sum death payment of $255, and that's payable to a spouse, a surviving spouse, or if there is no surviving spouse, then we can divide that amongst any minor children. Now, we talked a little bit about benefits for children under the Survivors Program, but I do want to point out that there are other ways for a child, even as an adult, to receive Social Security benefits from their parents. So this slide goes over and encompasses all of those different ways that they might qualify. So if you have a child who has a parent who is disabled or retired and entitled to Social Security benefits, or that child has a parent who died after working long enough and paying into those Social Security taxes, and that child is unmarried, younger than age 18, or they're 18 to 19 and still in high school, or they're 18 or older and disabled, and that disability began before the age of 22, then that child can qualify for Social Security benefit from their parents. So it's something important to think about. Just kind of tuck that in the back of your mind in case that does apply to you. The child who is disabled before the age of 22 that can receive those benefits into adulthood, the interesting thing about that as well is once they're entitled, because of their disability, once they're entitled to Social Security under their parent, then they also can eventually receive Medicare entitlement as well. That's usually very helpful in those situations. Now, to apply for benefits from Social Security, you're going to have some different options. I highly recommend going to our website at socialsecurity.gov. We have found on average it takes 15 minutes for an individual to complete an application for retirement benefits. You can file for your benefits 3 months in advance of when you want them to begin. So we're going to talk about the My Social Security account later in the presentation, but just know that if you're going to file an application online, you will be required to log in through your online account to verify your identity. If you do not have one of those set up, then I would encourage you to take care of that today so that you won't have any problems doing your application online in the future. Now, another option, if you're not comfortable going online to complete your application, you can contact us by phone and schedule an appointment. Currently, we are only doing appointments by phone, so we would give you a day and time in which we would call you to take care of your application. The number you see here on the screen is our National 800 number. You can reach out to them, or you can contact your local Social Security office to schedule your appointment. Now, pre-COVID, we did take applications if you just walked into the office, but unfortunately, in our new environment, this is just not an option right now. Our offices are closed for most in-person service. Only those with critical, dire need are available and to actually schedule an appointment to go into the office. Or there are some Social Security card issues that you can qualify for an in-office appointment. But for retirement applications, we're either asking you to complete those online or set up a telephone appointment currently due to our COVID safety precautions. Now, this is a screenshot of our website at socialsecurity.gov. When you visit us online, make sure you're going to our .gov website. It is a government website, and we don't want you going to any other websites and getting Social Security information. This is your source of information and your way to access your information as well. Just a little bit about our home page here that you see. Across the top is a blue bar. There's a menu button there. If you click that menu button, you're going to get a drop-down menu with about everything you can do on our Social Security site. So if you scroll around on our homepage and you're not seeing what you want, you can kind of narrow that down and go into those specific areas through the menu. On the right-hand side of the screen where you see the pictures, the 4 pictures there, in the upper right-hand picture, there's a retirement tile. When you click that retirement tile, it'll take you to our retirement landing page where we have lots of information about Social Security retirement benefits. But there's also a big blue button on that page that says Apply for Benefits. So if you're ready to complete your application, that's where you would go. Once you click that, it'll ask you to log into your My Social Security account, and then it'll allow you to complete the application online. Below retirement, you'll see the tile that says Medicare enrollment. If you're wanting to file for Medicare only, you can go through here, or if you've picked up Medicare Part A and you want to take advantage of a special enrollment period to pick up your Medicare Part B, then there are forms available that you can fill out now and submit electronically to us in order to complete that special enrollment period. To the left of that is the disability tile. And if you're looking for information about Social Security disability that we're not going to be covering today, there is a lot of information available there, as well as the application if you're looking to file. Across the bottom of the screen, you'll see some small round buttons. On the far left-hand side, the My Social Security account. This is where you would go to log in or create a My Social Security account if you do not have one already. Now we're going to move on and we're going to discuss working while receiving benefits. When you're drawing Social Security and you're under full retirement age, if you choose to work, it can affect your Social Security benefits. And this is true for either retirement benefits or survivor's benefits. So basically, Social Security, in order for you to be eligible to receive that early benefit and have that capability to do so, you have to be what we consider retired in order to qualify. And so what they do is they look at how much you're earning to see if you're able to file or if your benefit's going to be reduced based on your earnings. Now, once you get to full retirement age, you can draw your Social Security without having any reduction for your earnings. This only applies if you're under full retirement age. So you can see here, if you're under full retirement age in 2021, drawing your Social Security and working, you can earn and make up to $18,960 for the year before your benefit would be reduced. If you go over that amount, your benefit's going to be reduced $1 for every 2 that you go over. In the year you attain full retirement age, that amount changes. It goes up quite a bit to $50,520 for the year. And your reduction is a little less steep. It's $1 for every 3 that you go over. And then in your month of full retirement age and beyond, you can earn and make as much as you want without any kind of reduction. So let me give you an example just to differentiate between the year full retirement age is reached and the month of full retirement age and beyond. Let's say you turn your full retirement age in July. So from January through June, you can earn and make the $50,520 without a reduction. And then from July on, you can earn and make as much as you want. Another thing to note about this is that if you do work and have your Social Security benefits reduced because of your earnings, then once you reach full retirement age, you will get a credit back for any month that we withheld your Social Security check for your reduction. So let's say you took your benefits at 62, and between 62 and your full retirement age, we end up withholding 24 months of your Social Security checks because of your earnings. Once you reach your full retirement age, we're going to calculate your benefit again. We're going to go back, give you credit for those months that we didn't pay you a Social Security check because of the reduction. So in our example, if you had the 24 months withheld because of your earnings, then we would start paying you your age 64 amount instead of your age 62 amount, giving you credit for those 24 months. When we're looking at whether or not your Social Security should be reduced for earnings, we are simply looking at gross wages from employment or net earnings from self-employment. We're not considering any pension payments, VA benefits, inheritance payments, interest, dividends, capital gains, your income from investments. None of those things should be calculated in there. We're only going to be looking at your work earnings. Now we're going to move on to taxation of benefits, and this is really important. We find, unfortunately, that a lot of people are not aware that their Social Security benefits can be taxed. And we get some very upset phone calls, unfortunately. It seems like every year around tax time because of this. And so I want to make sure you're aware that your benefits can be taxed so that you are prepared for that. So you can see here whether you file an individual tax return or a joint tax return, you could fall into one of two categories in which your Social Security benefits are taxable. The lower category means that half of your benefits are taxable. The higher category means that 85% of your benefits are taxable. And the tax I'm referring to is federal income tax, okay? Now, the state that you're living in, they may tax your benefit as well. I would recommend researching into that. If you're planning on moving somewhere in retirement, you may want to take that into consideration as well. But what they're looking at to determine whether or not you fall into one of these income categories in which your benefits are taxable, they're going to look at your combined income. And your combined income is your adjusted gross income plus any non-taxable interest plus 1/2 of your annual Social Security benefits. When you add those three things together, if it falls into one of those categories, then you will be paying taxes on your Social Security benefits. At the end of each year, well, actually in January each year, we're going to mail you a 1099 form so that you can have that to complete your taxes. And you also have the ability to file a W-4V form, which is a voluntary withholding request with your local Social Security office, and we can do a tax withholding on your Social Security benefit just to help you offset those taxes when you do have them done. In order to do that, you will need to obtain that W-4V form. You can get it from irs.gov, or you can get it from our form section at socialsecurity.gov/forms. Just type in W-4V in the search box. You'll print that form, fill it out, send it in to your local Social Security office, and once they process that, they'll start the withholding. So there's not any certain point in the year in which you have to request the withholding. You can do it at any time. If you have questions about completing your W-4V form, especially selecting the percentages, we recommend that you talk to a tax preparer so that they can guide you in that. We are not trained in taxes, and so this is not something that we would be able to help you with. Now we're going to move on to Medicare. Most people think about Medicare eligibility at age 65. However, you can qualify for Medicare sooner depending upon your situation. If you've been entitled to Social Security disability payments for 24 months, that can start your Medicare eligibility. If you have kidney failure and receive maintenance dialysis or a kidney transplant, or if you have ALS, those two things can start your Medicare almost immediately. And then lastly, exposure to environmental health hazards. That was the last piece of Medicare legislation that Congress added to the Medicare Act. And what that does is it allows Congress to open up Medicare enrollment for a particular area, town, city, whatever the case may be, that's had some sort of exposure to environmental health hazard. Now we're going to briefly talk about your Medicare Parts A, B, and D. Your Medicare Part A is your hospital insurance. That's going to cover your inpatient hospital expenses. There is no monthly premium for Medicare Part A so long as you've paid in those taxes. But there is a deductible. So the 2021 deductible is $1,484, and that is not an annual deductible. That is a per occurrence deductible. So depending on the number of days it's been since your last hospital admission, you may have to pay that deductible more than one time a year. Your Part B is your medical insurance, and that's going to cover 80% of your doctor's bills and other outpatient medical expenses after the first $203 in approved charges. The $203 is like a deductible, and it does change from year to year with Medicare. Part B does have a premium associated with it. The 2021 standard monthly premium is $148.50, and that represents 1/4 of the total cost of that plan. Now, if you are considered a higher earner with Medicare, then you may be responsible for paying a larger premium for your Part B plan, as well as your Part D plan. And I have a slide we're going to go over in just a few minutes that shows that for you. Now, your Medicare Part D, that's going to cover your medications. And there's a couple of things that are different about your Medicare Part D than your Parts A and B. First of all, when it comes time to enroll in Medicare, you're going to contact Social Security to enroll in Medicare Part A and B. Part D, though, you have to find a plan and contact that plan provider to enroll. And that can be kind of a tedious process simply because there are many plan providers, and each provider offers about 3 different plans, and they range in costs and copays and coinsurance and so on. But there's 2 things that are extremely important to consider when you're looking for a Part D plan before you go shopping for exactly what you want. One is that plan available where you live? And 2, does it cover the medications you're taking? Now, I say available where you live. If you live in a rural area, you would want to make sure that's available where you get your prescriptions filled. Okay? So there is a plan finder on the Medicare website, and I'm going to show you exactly where that is in just a second. But it will allow you to plug in your zip code and your names of your medications, and it will take the big list of plans, and it's going to drill it down to just those available in your area that cover the medications you're taking. And then you can shop from there. It's going to show you the plan costs on the screen, as well as the contact information in order to enroll in that plan. Also, Part D has an annual enrollment period each year. It runs October 15th through December 7th. And this is going to be the time of the year in which you could switch plans. So if you're in a plan, you're not happy with it, you can shop around in that time period and switch and enroll another plan, which will be effective January 1 of the following year. Now, this is a screenshot of the Medicare.gov website. If you need information about Medicare, I recommend checking that out. But you can see there on the lower left-hand corner, there's a red square around a box that says Find Plans. So if you're looking for a Part D plan, that's where you can go and use their plan finder to drill it down to find one that fits for you. With Social Security, we are responsible for getting you enrolled into Medicare, but we do not have access to your Medicare information as far as your Medicare number. We also do not administer Medicare benefits. We do not, we can't answer questions about those Medicare benefits or coordination of benefits or anything like that. And so you would need to contact Medicare for information on those lines. You can see here their number 1-800-MEDICARE, or of course Medicare.gov is the website. I do also want to give you a little bit of information about an agency there in Texas. It's called Texas HICAP. HICAP stands for Health Information Counseling Advocacy Program of Texas. And what they do is they receive a federal grant every year to provide unbiased information about Medicare. They're not trying to sell you a plan or anything like that. They're a wonderful resource to go to if you have questions. If you need assistance finding a Part D plan, they can do that. If you need information about Advantage plans or Medicare supplements, they're going to be able to provide you that information as well. So they are a wonderful resource, and I'd highly encourage you to contact them if you have questions about Medicare. Okay, I referenced earlier when we talked about the Medicare Part B that the standard monthly premium was $148.50 for 2021. However, if you're considered a higher earner, then your premium for Medicare Part B as well as Part D can be higher, okay? So you can see here on the left-hand side, looking at your modified adjusted gross income, whether you're an individual or a married couple, that's going to show you the different categories where you may fall. So the first income up the ladder there is going to add $59.40 to your Part B premium, and your Part D plan, whichever you choose, they'll add an additional $12.30. So you can see as you go down the table here and the income increases, your share or your part of your Medicare premium becomes higher. Now, you may be thinking, I'm going to be retiring, my income is going to be less, okay? So whenever they're looking at this, they look at your income from 2 years prior. They do that because that's going to be the most recent income that we can go from in determining your Medicare premium and whether or not this income-related monthly adjustment amount is going to be added to your Medicare premium. If your income has changed since 2 years prior, you can contact your local Social Security office to see if you qualify, if you have a qualifying life-changing event that will allow us to reassess your income and see if we can lower those Medicare premiums. Things like, retiring, stopping work, that can change it. A divorce or a spouse passing away, those things can change it as well. There are other circumstances, but you would need to contact your local Social Security office. They can do an assessment with you. They can send you the forms to complete to make that request to see if it can be reduced. And then your local office will make that decision based on the information you provide in those forms. Now we're going to talk about the Medicare enrollment periods. These are very important. They're important because if you do not get enrolled in Medicare when you should, then you may be penalized. And we don't want to pay any more for Medicare than we should. So let's make sure we get enrolled when we should. So first of all, we have an initial enrollment period. Most people are going to, or a lot of people are going to look to enroll during the initial enrollment period. You will need to enroll during the initial enrollment period unless you qualify for a special enrollment period. But to enroll during the initial enrollment period, that enrollment period begins 3 months prior to the month of your 65th birthday, includes the month of your birthday, and 3 months after that. So you have that 7-month window wrapped around your 65th birthday to get enrolled. If you're enrolling during the initial enrollment period, we recommend that you contact us for 3 months in advance. That allows everything to be set up and ready to go. You'll have your card before you turn 65. So it basically gets that set up seamlessly to begin use once you're eligible. Now, to qualify for a special enrollment period, what that does is it allows you to skip your initial enrollment period and pick up Medicare later without being penalized. But you have to qualify for that special enrollment period in order to utilize it. To qualify for the special enrollment period, that means that during the initial enrollment period, you are working and you have group coverage through your employer, or your spouse is working and they have group coverage through their employer that covers you, and this is going to be the case for the duration of the initial enrollment period. If that is true, then you qualify for a special enrollment period. And your special enrollment period is going to begin the month in which your work ends or your insurance ends, whichever comes first, and the next 7 months after that. So you'll have 8 months total to get enrolled during a special enrollment period without being penalized. If you're going to pick up Medicare during your special enrollment period, we recommend that you do it in the very first month. That gives us the most flexibility of when your Medicare will start. The later that you enroll during the special enrollment period actually pushes out your Medicare effective date. The last general enrollment period we're going to talk about is, the last enrollment period we're going to talk about is the general enrollment period. And it runs January through March each year, and your coverage is not going to be effective until July. But if you're falling in that general enrollment period, then that means you did not get enrolled in Medicare when you should have. So they're going to be looking to see whether you should be assessed a penalty. For your Medicare Part B, you're going to have a penalty of, the penalty is 10% per 12-month period that you failed to enroll. So if 2 years go by before you get enrolled from when you should have, they'll add 20% to your Medicare premiums on a monthly basis. So every single month, you're going to pay an additional 20% on top of your premiums. This is a permanent penalty. It's not going to go away. It will always be there. Part D for medications also has a penalty, and it is 1% per month that you failed to enroll. So as you can see, it's very important to make sure that you get enrolled in Medicare when you should. Now, I do want to talk here for just a moment about the special enrollment period. So the special enrollment period, some people who qualify for it, they will pick up Medicare Part A during their initial enrollment period. And then they'll pick up Medicare Parts B and D, the other parts of Medicare that have premiums during the special enrollment period. And you can do that. Basically, if you pick up your Part A during your initial enrollment period, you still have your employer coverage because you're working or your spouse is working and they have that coverage. Then your Medicare Part A will be secondary. Of course, Medicare A is free to you, so it'd be a secondary coverage to your employer plan. And then once you stop working or your insurance ends, whichever comes first, you'll start your special enrollment for your other parts of Medicare that have those premiums associated. Now, if this is something that you're considering doing and you have a health savings account, then you're going to want to be particularly careful about when you enroll in Medicare and when you stop contributing to your HSA plan. We recommend that you contact your HSA administrator to go over that with them so they can advise you on what to do and when you're, as far as when you're planning to enroll into Medicare. Okay, so now we're at the section about My Social Security. My Social Security is our free online account that gives you access to your personal Social Security information and also allows you to conduct business with us electronically, saving you some time. So to create the online account, you would go to socialsecurity.gov/myaccount, and you only have to be 18 or older, have a U.S. mailing address, an email address, and of course, a Social Security number. Now, if you're not receiving benefits from Social Security and you create an account, here are some of the things you're going to be able to do. You'll be able to request a replacement Social Security card. If you are simply needing a replacement of the card that you had before, you're not changing your name or any information tied to your Social Security record, then you can request that replacement through your online account, and they're going to mail that out to you in about 2 weeks. You'll also be able to check the status of any application or appeal that you filed with us. You'll be able to instantly print a letter showing proof that you're not receiving benefits from Social Security. And of course, you'll be able to review all of your Social Security statement information. Estimates for your benefits at for retirement, disability, survivor's benefits for your family, all of that will be there as well. And of course, your earnings history will be available for you to review. We recommend that you review your earnings history yearly. So we do send you an email once a year reminding you to log in to do that. We want you to look at your earnings history to make sure those earnings are posting so that once you get to retirement, if you're missing a year or two here or there, it becomes a little more difficult for you to find the documents or information we need to add those earnings to your record. However, if you're checking it on an annual basis, then you're more likely to still have your W-2 information so that we can go ahead and obtain that from you and add it to your record. Now, through the My Social Security account, once you transition and you start receiving benefits from Social Security, your account's going to change and there's going to be additional services available to you. You'll still be able to request that replacement Social Security card. If you're receiving disability benefits from Social Security, then you'll be able to report your earnings if you go back to work. You'll be able to instantly print a proof of income letter from Social Security. So if you're needing that for any reason, you can print that out without ever having to call and ask for one and wait for one in the mail. You'll also be able to check your benefit and payment information. So when you log into your account, it's going to tell you the type of benefit you receive, how much it is, the day of the month you receive it on. It's going to tell you what parts of Medicare that you're enrolled in. If you have any overpayments on your Social Security account, then it's going to list those for you and give explanations for them. It's also going to show you the address and phone number that we have on file for you. And if those need to be updated, you can simply click an edit button right there on the screen and provide the new information. you will also be able to update your direct deposit information. So when you file for benefits with us, we are going to ask you to provide your bank information for direct deposit. If that needs to be changed, then you can log in through your My Social Security account, provide us your new bank information, and we'll also let you know when that next check, when the new account will be used for your deposit. So you'll be able to know if you need to close out the prior account or not. Okay, so that was everything that I had to share with you all today, and I would love to just open this up and see what questions we have. I noticed a few of them popping in as we went along.
Yes, thank you so much, Phyllis. We did have several questions came in, and there was a couple. If we just go back to some of the questions around spousal benefits and survivor benefits.
Okay.
So one of the first ones that we had was, if you are divorced and remarry after age 60, would you still maintain eligibility at age 62 to claim benefits based on your prior spouse's income?
That is a great question. So with divorced spouse's benefit, it's different, okay? If you remarry, even though it may be after the age of 60, you do not qualify for the divorced spouse benefit anymore. That's only going to be survivor's benefits, where you maintain that eligibility. But a spousal benefit, no. Now, let's say you were married, divorced, remarried, and later divorced. Now you've opened up entitlement again, okay? Or you may have, depending on how long each of those marriages lasted, you may have opened up entitlement under 2, and we need to review it and see which one's the most advantageous.
Okay, great, thank you. What about going back to survivor's benefit? So if you are eligible and their surviving spouse is of retirement age, does that person receive their own Social Security benefit plus a survivor benefit, or is it just whichever is more advantageous?
It's whichever is more advantageous. So the key there is looking at that survivor's benefit, though. You have the option. If you are, if you're younger and your spouse, you were married to someone who passed away and you're looking toward retirement and you're trying to decide whether you should take a survivor's benefit or your own retirement. Your own retirement may be higher at that point, but you could weigh your options here. You do have the option to take that survivor's benefit, even if it's lower, and let your Social Security benefit grow and maximize your benefit. So that would be something you'd want to consider. You don't have to automatically take the higher one in a surviving spouse situation.
Okay, great. What about, can you clarify that if you receive a spousal Social Security benefit at age 67, and if you've never collected any credits on your own record, do you still get that 50% level amount of your spouse's benefit? You
Yes.
don't need to have any entitlement on your own credit, correct?
Correct. And you also can receive entitlement for Medicare through your spouse. So okay. That would be something you might want to consider at age 65. But in that situation, the spousal benefit really was designed to be for those who maybe stayed at home and they didn't work in the workforce and contribute, and so that's where the spousal benefit was created for. It's used kind of differently today, but you can file for that spousal benefit even though you've not worked and paid into Social Security.
Okay, great. We have another one here, and this is a good one, one that one I hear often, but how does an unmarried divorced person find out how much their spousal benefit could be if they claimed on the next spouse?
That is a great question. Any spousal benefit, you're not going to be able to access that online, whether it's a divorced spouse or current spouse. Now, of course, your current spouse could log in from home and you all review that information, but For a divorced spouse situation or even survivor's benefits, you're going to want to contact your local Social Security office. We will ask you for information about that prior spouse in order to look up their record. If you have their Social Security number, great. If you do not, just some identifying information is all we need sometimes just to locate it. And we can give you an estimate of what you would be eligible for.
Okay, great, thanks. Okay, we have another one. We have someone who's a veteran who served from 1979 to 1990, and he understands that he's eligible for additional benefits. How does he go about applying for these additional Social Security benefits?
Okay, well, first of all, I want to say thank you for your service. We so appreciate that. As far as military veterans, there is kind of a misconception out there that there's additional benefits. So basically, for a time period, if you were active duty military, they were not withholding Social Security taxes from your check when you got paid. And so later, Congress decided to go back and give credit for those Social Security credit for those earnings. So what they did is they went back, we received that earnings information from the VA and applied it to your Social Security record so that when we are calculating your benefit, those are taken into consideration. So it you know, of course, any additional earnings that you have could increase your benefit, but it's often told and given out as, oh, you have this additional benefit in addition to your Social Security. So what we do when a veteran files is we ask for their active duty dates. We take that information down and we compare it with the information we receive from the VA through data exchange. If that information does not match up, then we request you to mail in your DD-214 so that we can properly document your active duty dates and make sure that you're getting Social Security credits for those earnings.
Great, thank you. One more here that we just had come through, and the question is, how do you apply for the spousal benefit for a person over 65 who has never worked to collect any credits? Can they do that online? Do they have to have their own My Social Security account?
You can file for spousal benefits online, and you can set up an account even if you're not insured for benefits from Social Security. When you file, it will be for, it's a little confusing, it's actually you're filing a retirement application, and in that retirement application we're going to indicate that you want to file for spouse's benefits. And you'll also want to put in remarks that you are filing on your spouse's record. And then once the office receives that, they're going to then know, okay, this is actually a spousal application. Your other option, you know, if you're not comfortable doing the online, of course, is to contact us by phone and we'll schedule an appointment to take care of that.
Okay, great. Well, this has certainly been really helpful. Haven't seen any other additional questions come through, but of course, if any of you think of something after the fact, you can always email us, your advisor at ML&R, one of our contacts here, and we can get that addressed for you. Thank you very much. Okay.
Thank you so much. You all have a wonderful afternoon.